For over 100 years, the Philippine Women's University has been known as a leader in quality education. In 1934, PWU moved into its main campus on Taft Avenue, and since the 1970s has been co-educational. Located in the heart of Metro Manila, it is easily accessible by public transport and surrounded by affordable housing. PWU School of Nursing has been offering high-quality, student-centered, and innovative nursing programs for over 6 decades. PWU's graduate programs upgrade the qualifications of nursing professionals, allowing them to advance in their chosen fields in the Philippines and globally. In the allied health fields, PWU pioneered in programs such as pharmacy, which was established in 1926 to train students who want to succeed in any aspect of pharmacy services. The first women doctors polyclinic in the Philippines was set up in PWU in 1951. In 1986, PWU's Bachelor of Science in Nutrition and Dietetics became the first nutrition program to be accredited by the Philippine Association of Colleges and Universities. PWU was also the first educational institution in the Philippines to focus on the prevention of acute illnesses and chronic diseases through its Master of Science in Clinical Nutrition program, taught jointly with the St. Luke's Medical Center. PWU School of Medical Technology offers a competency-based curriculum enhanced by intensive training in clinical laboratory procedures. Offering a Bachelor of Science in Medical Technology and a Master's program in Medical Technology and Health Systems Management, PWU also offers a certificate program in phlebotomy. In nursing and the allied health fields, PWU continues to play an essential role in healthcare education, producing graduates who possess the skills that make them competitive in the country and anywhere in the world.
Webinar rules and regulation. Make yourself comfortable, conducive for learning. Turn off or mute your sounds to avoid unnecessary noise and sounds. Be mindful also of your actions since everyone may also see you. If not necessary, you may turn off your camera. If there is someone talking, please give respect by letting the person finish the topic being discussed. There will be a portion for question and answer. Please save all your questions. Wait for the cue of the host as to when to give your questions via live chat. Always remember the use of online etiquette. Good morning, everyone. I want to personally welcome you all to the webinar entitled Mental Health Resilience Amidst the COVID-19 Pandemic. I am Dr. Maria Del Rañeses, the webinar facilitator and a graduate student taking a PhD in nursing. Ladies and gentlemen, let us start by first invoking the presence of the Lord through a solemn prayer and give respect to the Philippine flag through the Pambansang Awit ng Pilipinas.
Let us put ourselves in the holy presence of God. Father in heaven, always merciful and giver of life, we humbly ask that you bless each one of us, from the speakers, program committees, guests, and participants. Guide us to make better decisions as we incorporate what we will learn throughout this activity. Thank you for the infinite blessings and countless opportunities. Lord, today as we start our activity, may we always be grateful to learn new things. Shed the light of your wisdom and bless each one, especially our speakers, as they will share their knowledge to us. Through your mercy and grace, may peace and utmost understanding shine and dwell unto us. Almighty God, accompany each one and help us concentrate for us to gain more knowledge as we listen attentively. This we ask in your name. Amen.
We are overjoyed of your presence and participation in this event, and we know that by the end of this activity, you will gain valuable insights and apply it in your daily lives. In the meantime, friends, to acknowledge our lovely presence in this remarkable event, let me call on my classmate, a co-webinar facilitator, and a unit manager at Pasay General Hospital, Miss Esperanza Banabata.
Thank you, ma'am. Good morning, everyone. On behalf of the organizing committee, we would like to acknowledge our distinguished participants in this day's webinar. We have here our dearest students from different universities and colleges, locally and abroad. First, we have from the Affiliated Hospital of Zuni Medical University, Ateneo Dinaga University, Arellano University, Bataan Peninsula State University, BS Medical Technology of Philippine Women, BS Emilio Aguinaldo College, BSN Lipa City Colleges, BSN University of Makati. Also, we have here Bicol University, Orani Campus, BSN University of Visayas, Cabcaben Elementary School, City Global College Laguna, Mabini College of Nursing, Jose Rizal University. Also, we have La Consolacion College of Diet, LPU St. Cabrili School of Health and Sciences, also the College of Medicine of LPU, Lyceum of the Philippines Laguna. Also, we have the BSN, MAN, PhD students of PWU, School of Nursing and Health of Xinjiang University in China. Also, the New Era University, New Zenai School and Colleges, Our Lady of Fatima University, Pamantasan ng Kabuyao School of Nursing, also San Pablo Colleges, School of Hospitality Management of PWU, the Medical University of Zamboanga, China, also University of Nueva Cáceres, University of Perpetual Health System Delta, University of St. Anthony, University of Santo Tomas, Manila, Liceo de Cagayan University also here, Daniel B. Peña Memorial College Foundation, and last, Brokenshire College of Nursing, General Santos City. Also, we have the participants from different hospitals and medical institutions, locally and abroad. We have the following: Balala Public Health Center, Al Hayat Polyclinic, City Health Office Tubingan, City Health Office Calamba, United Balagtas Doctor Hospital, Daniel Mercado Memorial Medical Center, Ferdinand Air Base Hospital, Grace Mission Hospital, Hamad Medical Corporation, Yuzhou Provincial People Hospital in China, Yuzhou People Hospital also in China, Lung Center of the Philippines, Maria Estrella General Hospital, MMG Hospital, Rizal Medical Center, San Lazaro Hospital, St. Clair Medical Center, St. James Hospital, St. Carolus Hospital in Jakarta, the Medical City, Veterans Memorial Medical Center. Also, we have Mother Mercy Hospital, Olaya Medical Complex, Oriental Mindoro Provincial Hospital, Hospital ng Binyan, Philippine Heart Center, Ramos General Hospital, and also Pasay City General Hospital. Let us also acknowledge, my dear, and welcome our dear participants from different private companies and government and non-government organizations. We have the Ampelion Philippines, Commission on Higher Education, Department of Education, Division of Calibuyao, Laguna, Division of Calamba, Division of Santa Rosa City, and Division of Tabaco City. We also have here the Department of Health Center for Health Development, Calabarzon, DSWD, Heaven for Elderly, IMAP Incorporated, DOH Region 2, Philippine Nurses Association, and lastly, Philippine Red Cross. To all the participants, thank you very much for gracing us your time to attend this very important event of us. We are looking forward for all the learnings that you will acquire as we go on. Again, thank you very much and a warm welcome to all of you.
Thank you very much, Ma'am Pai. Yes, thank you for your overwhelming presence. We are reaching as far as the United States, China, Saudi Arabia, Qatar, and of course we are live all over the Philippines. Now, ladies and gentlemen, to formally welcome you all and to briefly explain the purpose of this activity, let us call on my other classmate, our group's overall chairperson, and the chief nurse of San Antonio Medical Center of Lipa, Mr. Christopher Nemes.
Thank you, Ms. Bambi. To all the participants and organizers of this event, a pleasant morning to all of you. The Doctor of Philosophy in Nursing students, Section A, Group 2, is conducting this webinar session entitled Mental Health Resilience Amidst the COVID-19 Pandemic. This is an activity for the training and education aspect of the course Practicum in Nursing under the advisorship of Dr. Minerva de Ala, the Dean of the School of Nursing. The main objective of this activity is to discuss the importance of mental health, resilience, and how a person can reinforce it, most especially during this time of COVID-19 pandemic. Because of this global problem that we are facing, we were separated from our loved ones. Our own financial sources have been affected, and at the present, we are still doing our best to cope up with this new normal situation. With this, the behavior and the way people think might have changed and affected as well. Therefore, aside from our physical health, it is also imperative to us to increase our own mental health resilience during this difficult period. With our professional and expert speaker present on this morning, We were looking forward to receive the new knowledge that will equip us to make this webinar possible. Again, to all the students, faculties, professionals, and all the participants out there, we thank you for gracing us your time as we continue with this online webinar endeavor. On behalf of the PhD nursing student, I welcome you on this fruitful activity. Maraming salamat po at mabuhay po kayong lahat.
Thank you very much, Topher. Yes, ladies and gentlemen, we will be graded on how excellently we will go through all this. Now, ladies and gentlemen, one of the highlights of this activity is listening to the man at the helm, the university president. Hence, it is such pride and honor to introduce to you the great-looking and hard-working president of Philippine Women's University, Mr. Marco Alfredo Benitez, for his inspirational message.
Dr. Filina Yang, University Chancellor and SVPAA, Dr. Minerva De Ala, Dean of the PWU School of Nursing, our hardworking faculty, distinguished alumni, dear students of our PhD in Nursing program, and everyone watching on our social media accounts, good morning. I would first like to congratulate the organizers of this webinar series, which begins today with the topic Mental Health Resilience Amidst COVID-19. More importantly, I would like to express my heartfelt appreciation to you, our nurses in the front lines. Thank you for your tremendous sacrifice and heroic service during this very difficult time. We are in the 7th month of this pandemic. The world's confirmed cases have breached the 30 million mark, with deaths at around 1 million worldwide. Here in the Philippines, we just recently passed 300,000 confirmed cases, still averaging around 3,000 cases per day, and have already reported more than 5,000 deaths. While Metro Manila remains under general community quarantine, GCQ and the neighboring provinces under MGCQ, the daily number of confirmed cases, our positivity rate, as well as the number of deaths indicate that we have not yet flattened the curve and that the end of this pandemic is not yet in sight. This uncertainty as to when we will actually be able to go back to our pre-pandemic lives, or at least even go back to some form of face-to-face classes, coupled with the economic impact that lockdown has had on our communities, and more importantly, the fact that there still exists that real risk of contracting the virus, have definitely caused tremendous anxiety and even some mental health concerns all around. This is the reason why I believe your chosen topic for today's webinar is very appropriate. While there are many ways to address mental resilience, which I'm sure you will be discussing today, allow me to share a couple which I feel have worked for me. First would be to establish some sort of normalcy. This can be in the form of a daily schedule, even if we are still under quarantine. That means waking up at a set time each day, getting ready for work or school the way we used to, even if our attire is a little more laid back for those working or studying from home, and basically establishing some type of rhythm and structure similar to what we had prior to the pandemic. This was actually one of the reasons the university, even back in March, decided to push through with remote learning despite pressure from different sides not to continue. We knew we had to establish some form of normalcy for our community, particularly for our students. The second is gratitude. Despite the major challenges we are currently facing, there is still much to be thankful for. The fact that we are here, healthy, watching this webinar and continuing with our studies is already a blessing. I've heard stories from our faculty who say that they have not spent this much time with their families for as long as they could remember. Personally, knowing that there are hundreds of private schools that have closed because of this pandemic, many of which will no longer be able to reopen, while we here at PWU are still able to continue with our mission of giving quality education, providing livelihood for our members, is something that I cannot be thankful for enough. Knowing and realizing all of these, as I'm sure you have too, within your own context, gives me reason to remain positive and mentally strong. Last but definitely not the least is faith. We all have to have faith in our God. in a higher being, and in a greater purpose. This tells me that a once-in-a-lifetime pandemic like this cannot be just some random act of nature, but that there is a plan and that this great challenge we are all facing is here to make us better as individuals, as a community, and hopefully as a people. This leads us to look for opportunities for ourselves and for the university, whether small or significant, to be able to make things better for others. Initiatives such as our Institute of Family Life's Kamustahan sessions, where members of our community can voice out their anxieties, the regular Friday Mass that we live stream from the PWU Chapel, and even, for example, the donation drive for the PGH Medical Foundation we did last April, and for our employees who have used up their leave credits last June and July, are all aimed at trying to make things even just a bit better for all of us going through these tough times. Faith tells us that by following the science, abiding by public health guidelines, and with the arrival of a safe and effective vaccine, one way or another, this crisis too shall pass. But I firmly believe that this pandemic would have been a wasted opportunity if we did not come out of this as better human beings. So let us all take this webinar and the succeeding one as opportunities to better ourselves and hopefully to learn something that we can share to help others. Thank you once again to the organizers, and I hope all of you continue to stay safe and well.
Thank you so much, Mr. President. Your words reverberate with such warmth, wit, and worthwhile support for us nurses as frontliners in this time of pandemic. And thank you too for your great support for us as graduate students and to the undertakings like this seminar or webinar. It is with pride to be enrolled in PWU. At this juncture, ladies and gentlemen, to introduce to us our most esteemed resource speaker, may I call on another classmate of ours in the PhD in Nursing, the Committee Chair on Program and Presentation, and the Nurse 2 at DepEd Cabuyao, Laguna. Please help me welcome Mr. Gilbert Bagsig.
A pleasant morning to all of our viewers and participants. It is my greatest privilege and honor to introduce our resource speaker for this webinar session on mental health. Our resource speaker is a graduate of Bandik Elementary School, class valedictorian at Calamba, Laguna in 1982. She took her secondary level at the Laguna College of Business and Arts in 1986. In 1990, she finished her degree of Bachelor's of Science in Psychology, major in Industrial Psychology, at the Far Eastern University. In 2002, she finished her Master's of Science in Psychology at the Laguna College of Business and Arts, or LCBA. She also took up the Master's of Arts in Education, major in Guidance and Counseling, complete academic requirements at the LCBA and the La Salle University in 2007. She is a resident psychologist, college professor, and practicum coordinator of College of Arts Sciences at the City Global from 2017 up to present. She also served as a guidance director and a college instructor at the City College of Calamba, Laguna College of Business and Arts. She was the acting dean of LCBA in 2001 for the College of Arts and Sciences. She is also a regular radio guest every Sunday at DZRJ 101.5 FM Big Radio, where she gives mental health tips and advices. A registered psychologist, mental health advocate, and practitioner. Without further ado, to give us the discussion on mental health resilience amidst the COVID-19 pandemic, let us all welcome with a virtual clap, Ms. Noralle G. Collado. A pleasant morning to you, ma'am.
Okay, good morning. I'd like to congratulate in advance the organizer of this webinar, PWU Manila. Thank you for inviting me. And to all the participants this morning, I hope that you're going to start your day today with a smile. Remember that every time you smile, you're giving yourself a reward. And that reward is that you're going to produce positive emotion. And if you're always have this positive emotion, you will be able to maintain a good health, and that health is but a contribution to your own mental health. Remember, every day you try to invest 10 seconds of your life, only 10 seconds, and that 10 seconds will only be 5 seconds inhale together with your negative thoughts, and then later on gradually exhale, throw them away inside the trash can, so that every day you'll be able to experience good health in your life. Actually, I invited here 5 COVID victims. They are now suffering from COVID-19 crisis, but again, I keep on telling them, you just move on with life, because it's only one trial in life that we can survive. Remember, our goal in this webinar is to protect our own mental health. We would like you to know, and I want you to know, that all the participants here, after this, you can share to your relatives, to your friends, to the people in your community, that the main goal of this webinar is for us to be protected from the pandemic, from this crisis. And at the same time, I want all of you to prevent experiencing mental crisis, mental health problem. So we need to prevent mental illness. That's why we have to preserve our own mental health and promote the power of these two, your strength and your bravery. Guys, tell yourself now, I am a good person. I can survive and I can beat this pandemic crisis. We have to bear in mind that we have to understand that a lot of children nowadays, they're suffering from too much problems. There are children now who are suffering from stress, children who are suffering from too much worries in life, and sometimes those can cause them to experience depression. We are here because you want to help our relatives, the elderly, and the other family problems to remain strong. This pandemic is stressful. I know that because I also experienced this COVID-19 problem. Later, I will tell you how I survived from this COVID-19. Sir and mom, a lot of people do not know that I experienced such crisis in life. But again, the only thing that I did is to pray, to take my medicines, and to focus on positivity. So today, try to identify your own emotion. If you have now negative emotion, reframe it, make it positive. And that positive emotion can help you to prolong your life and to experience this, what we call mental health, positive mental health, and emotional well-being. On the second slide, you can see there that there's one confused person. Sometimes we are asking ourselves, and most people nowadays, because I am conducting seminar webinars, counseling, administer exams to those people who are suffering from this pandemic crisis, and they keep on asking. And I also want to ask each one of you, are you always scared? Are you always exhausted? Are you always drained in your life? Do you experience stress? Are you always stressed? Do you always experience to be afraid? Are you tormented? I have 2 words for this morning. Children, teens, people caring for family members, frontliners. I really adore all of you. Essential workers, those with existing mental health condition, those who lost their job and family members, those who have disabilities, those who are homeless and abandoned by family. 2 words lang po, laban lang. We have to face the reality that we are now having such problem. But if we are strong, we can beat pandemic crisis. And this COVID-19 later on, mawawala po ito. For as long as you believe that you can survive, always think that I am a worthwhile person. Now, when you see each other through social media, you can see there that they keep on talking a lot of things about COVID-19. Is this the end of the world or the start of a new journey? We are not, for example, thinking of ending our life. We are here because we want to prolong our life. That's why in the new normal, what we have to do is to make use of the principle of rain. So what do I mean by rain? Starting today, accept the changes, accept the challenges in life. These drastic changes can give us a good life to live later. If not, Remember, if you cannot overcome, if you cannot survive, it could possibly affect your mental health. And remember that we have to value our own mental health. We have to revalue our own mental health. And at the same time, always ask yourself, ask other people, are you okay or not okay? If you are not okay today, accept it. There's nothing wrong with that because not all the time we are okay. Because I will tell you that resilient behavior can help you to be okay for the rest of your life. The word rain has a meaning. It can help you to live in a normal life in this new normal. You can overcome all the challenges, all the changes in life. First, recognize your emotion. Whether positive or negative, allow it, acknowledge it, and accept it, and later on, investigate what causes you to experience such emotion. After that, make it non-identification or make use of non-identification. When every time you click, for example, your cell phone, you just scroll, then later on, hayaan lang siya dyan. Focus again on your life. Always think that I am a good person. I have a better life to live. That's why I have the best weapon to fight back this pandemic crisis. And that is your faith that you can survive in this crisis. Okay. Actually, on the next slide, you can see two people talking to one another. And those people have their own struggles in life. Remember that negative emotions can lead us to a downward spiral, which is this can cause us to experience a dysfunctional self. There are people who always discuss about their own struggles in life. Aray ko, hindi ko na kaya. Pain, sorrow, emotional suffering. Nawala ang nanay ko, nawala ang work ko, nawalan ako ng goal sa buhay. Nagagalit ako. This feeling of anger can cause negative thoughts. And at the same time, nagsiself-pity tayo, ayaw ko na, kawawa ako. Do not do it to yourself. Sometimes, people experience negative emotions because they have a lot of complaints about life. And sometimes they also experience feeling of hatred. If you are going to analyze this, if you have less struggle, less pain, less judgment, and less negative emotions, you can have a good self to live. On the other hand, the other person, despite of the fact that we are experiencing crisis, did you know that she or he also experienced love, happiness, emotional stability, bravery, acceptance, care, and hope. For what reason? Because of the support system. Who should be your support system? You should have a good support system or social support system. Your family, your friends, your co-workers, the people in your community. Although there's no such thing right now as face-to-face communication, to the use of the social media, you can still connect with them. Remember that good connection with people can lead us to experience a lot of positive emotions. And these positive emotions would really affect us positively. And as we all know, positive emotion is an upward spiral to a good self. Starting today and after the webinar, I just want to request each one of you, you just get a small piece of paper. You just write down at least one emotion that you can feel after the webinar. You just read it for several times, and after that, if it is positive, just keep it. If it is negative, again, reframe it. We all have the chance to experience positivity, but you try to avoid experience toxic positivism. Do not force yourself. It is but a gradual but sure process. Always think that you can do something good to yourself. One is be humble. If you are a humble person, if you're full of humility, you can easily experience positivity. If you are a boastful person, most of the time you will experience negative things in life. So if I were you, you try to choose the positive one because as we all know, we want, again, one thing for sure. We do not want a lot of title nowadays. We do not want a lot of positions. What we want is a good mental health. As I go along with the discussion, you try to reflect. You can feel now something within you. I remember one time, it was several years ago, I met someone who has an AIDS. And she told me, Ma'am, I can survive. So right now, during this pandemic crisis, buhay na buhay pa po siya. It only means that COVID-19 is only temporary and we are given life to survive and to fight. On the next slide, I put there COVID-19. You might feel afraid. But remember, according to our priest, we have the three zones in life. And those zones in life can help us to develop more courage. And that courage can help us now to develop optimism in life. And if we are optimistic, this is but a great victory. And what victory is that? We are still alive. And we can serve as an inspiration. And letter D means what you are doing right now is a designed life. You are designing your own life and what must be done. There are three zones to be considered in order to design a good life. We all started with the first zone of life. Sometimes we experience negative things, and the first zone is the fear zone. Unconsciously, a lot of people spread negative emotions simply because they are affected by this pandemic crisis. Sometimes they're becoming mad, annoyed, unreasonable, and there are people who engage into retaliatory aggression, but they don't know how they feel this one. But again, starting today, after knowing all those negative emotions, the second thing that we have to do is to go to the next level, which is the learning zone. Learn to stop compulsion, irrational acts. Instead, identify your other emotion. It could be happiness, affection, or any other positive emotion. Always be aware of your own situation and evaluate all the information that you're receiving. Because if you can do it, you can now proceed to the next zone, which is the growth zone. Now, this time, we are all human beings. We have rational thinking. That's why we can make our life okay. You can make the life of other people better. Start living with positivity. And one important thing, always bear in mind the importance of gratitude. Always say, thank you, Lord, for giving me a life to live. Love yourself, love other people, and please help all the people as much as possible in your own way. Money alone is not a help. When you listen, you are helping. Remember, the word listen. Pag binabali-balita niyo po yan, it will become silent. So sometimes, we have to keep silent and listen to the voices of those people suffering from this mental health crisis. And we can only do this if we have a lot of motivation. In all books of psychology, we have motivation as a topic, but this morning, we only need three types of motivation. I will not consider that only for today, Abraham Maslow. I will consider only three types of motivation based on what I experienced. Number one, we need to survive. Survival motivation is important. So ask yourself now, as parents, as caregiver, as breadwinner in your family, as students, can you now tell yourself, tell your family members if you are now having a good life kasi kumakain ka ng maayos. But again, eating three times a day is not enough in order to survive, in order to have a good life to live. The second is, if you can sustain now all the physical and basic needs of the whole family, another type of motivation is security. Can you secure your family? Can you tell me now that mom, sir, classmates, co-workers, I can give an assurance that my family is always okay, that they are out of danger. So if you can sustain the needs, you can secure your family, everything is nothing if you do not have a goal in life. If you're familiar with GPS, if you are driving a car, sometimes there are drivers who would like to have their own GPS. But this morning, in mental health, GPS has another meaning. It has nothing to do with driving a car. It has something to do in driving your life to have a good result, good output. Number one, GPS. Know your goal, know your purpose in life, and know your scope. If you're aware of this GPS, for sure after the webinar, you can start a good life to live. So those motivations can help us now. So do not say, ayaw ko na. Instead, tell yourself, kakayanin ko ito. Although we have a lot of expectations. A lot of people are expecting for sana okay na ako bukas. A lot of people are aspiring to have a good education despite of the fact that there is no such thing as face-to-face interaction. If you are dreaming to have right now a good life to live, it can be a reality if you will do something good to yourself. Inject discipline and everything will be okay. Okay? Now, the next one po. We can see that a lot of people in the new normal, they are reflecting a lot. So this time, why not reassess yourself, reassess your family, the relationship that you have with your family, make use of your strength, your inner strength, to understand why is it that in your workplace, different people have different behavior, different attitude right now, and why is it that right now we have our own personal goal, and yet there are cases wherein we cannot reach them because of this crisis. Sometimes the crisis serves as a barrier. But now, I'll start with the self. If you have an authentic self, you can accommodate things, ideas, and information coming from other people in the new normal to the use of the social media. You can listen, you can process, and at the same time, you can put a boundary. Please do not absorb, because a person with an authentic self can accept, can process, and still can be productive all the time. If you have a confined self, these people are prone to experience mental illness. They accept, but they don't know how to process. They do not want to put any limitation. That remember, we all have limited energy. So do not waste your energy dealing with toxic people. Instead, talk with those people whom you think can help you and can help the whole community. And the second one is your family. The family is but a contributing factor to your own mental health. But the problem is, there are families who are dysfunctional, families who do not want to support the children. So I am hoping, praying, and wishing that you have a good family, because your family members can give you emotional support for you to develop a well-being personality. In your own community, can you reflect now? Do you think your community now has a peaceful, do you think all the people in your community has peaceful mind? But I think in all communities right now, in our society, in our country, and globally speaking, we are full of struggle, but we keep on fighting. We have the self, the family, the community, and how about the workplace? Did you know that my first course is nursing? That's why one of the reasons why I accepted this one is because I really want to become a nurse. But I was not given the chance to finish my course because of my height. During my time, the required height is 5'1" or 5'2", and my height is only 5. But I do not have any regrets in life, because after graduating with psychology, I realized one thing, that whatever is your course, if you want to become significant and successful, you just do and accept what is given to you. Your workplace is important, especially the nurses. I really adore all of you. Every week, I keep on posting videos about frontliners because my husband is also a frontliner. That's why I really give respect to those nurses and other essential workers, or whoever are those people helping the community. I love them all, because when you love yourself, your family, your community, and the workplace, you can have now a strong self and a strong sense of mind. And your personal goal. What is your personal goal? Do you think is that you can finish your PhD? Do you think you can finish your college? Do you think you can receive your diploma by next year? So today, What I want is not only to become a successful person, but to become a significant person, to become a blessing to other people. My age is 50. I belong to middle age. Money for me right now is secondary because my personal goal right now and my mission is to help, to share, and to give blessing to other people. So your goal is important. Make your goal significant so that you can also give blessings to other people and you can bless the life of other people. And I will teach you now the three important letters in the alphabet. There are only three. The first three letters, A, B, and C. So we'll try to check the changes, the challenges with regards to our own mental health. On the next slide, you consider that we have now a different lifestyle. If you're going to compare the old normal with the new normal, you might become confused. Before, if you would like to be with your friends, you can call them over the phone and later you can meet in one place. But now, in the new normal, it is impossible to happen because we have limitations. So let us look on the next slide. Our lifestyle changed a lot. Number one, the system of education. A lot of parents are becoming so confused, especially those parents who lack education. In elementary level, if you do not know what are the lessons to be taught to your children, you experience stress. For those who are enrolled right now in college, in your doctoral or in your PhD, your lifestyle is really different as compared before. But again, the lifestyle, the system of education, and the CCC. And what is that CCC? Start connecting with people, start communicating with them, start collecting good experiences, and those experiences can be pleasant and unpleasant for as long as they can give meaning to your life and can give good meaning also to the life of other people. Start analyzing your value system, your priorities in life. What is your priority? Is it more on gaining material things or more on taking care of your own mental health? What is your perception now about life? Do you think you can have a good life after this? Do you perceive life better in the new normal? I will tell you because we have the FEBTS. So what do I mean by this? Alam niyo, or did you know that when we talk of the FEBTS, I will tell you now, you try to feel and I will enumerate to you what are the meanings of this FEBTS. Number one, check your feelings. Is there any change in your feelings and emotion? Do you always experience overwhelmed emotion? Are you becoming interested right now in your work or tasks? Do you lose, for example, do you have feeling of uncomfortable every time you talk with people? Do you feel numb? Do you have feeling of this what we call guilt, toxic guilt? If you feel this one, those things can damage our mental health. So you can seek, for example, professional help from other people. How about your behavior? Do you experience crying spells, outbursts, avoidance behavior? Are you going to engage into an argument in which you don't have any idea at all? In your thinking ability, do you have difficulty in making decisions, short attention span? And in your spiritual life, do you abandon now your religion? Do you reject spiritual beliefs or your physical? Do you always experience fatigue, aches, pain, sleep disorder? If these things are happening, these drastic changes are happening, bear in mind, make them as challenges in life. As we all know, we need to ask help if necessary. Because challenges sometimes can serve as an inspiration, but if you feel that these challenges are no longer helping you, it could affect and it has a great impact in your own mental health. So always think of the three letters in the alphabet: A, B, and C so that we can have a good mental health. Number one, because of this lifestyle, system of education, CCC, priorities, perception, and FEBTS, we need to understand that there are three important letters in the alphabet. Accept change. Embrace change. Be optimistic. Take action and nurture your health. Those are the things that you can do because what we want is to help a well-being self. Okay? So let us proceed now. You can ask now if you have a family member with you right now, are you okay or not okay? Remember, there's nothing wrong if you're not okay today because we have what we call tomorrow. If you're not okay today, palipasin lang po yan because tomorrow you can be okay. Always think that you are a great warrior. So do not be a worse warrior. You are a warrior, so you can fight and you can beat and you will remain strong. But again, there's nothing wrong if you're not okay today. You can jot it now. You can write in a small piece of paper, I am not okay. And then after reading it, throw it away. Then get another piece of paper and write it. Write one word, okay. It will help you a lot. Another one, if you are not okay most of the time, we have to know what is mental health. Because mental health is important. We are all open. We are all open for suggestions later. Mag-suggest kayo anong pwedeng gawin. Remember, according to WHO, when we say mental health, the person is physically or has a physical, social, and mental well-being. Ask yourself, are you still adaptive despite of this pandemic crisis? Are you still productive? Are you still accepting pressures with grace? What do you think are your contributions in your society? Can you still contribute even though you're experiencing a lot of crisis in life, a lot of stress, anxiety? So as long as you are realizing your own ability and can still cope with the stresses of life, you are still normal. So why do we need to understand the importance of mental health? Number one, it can save lives. We all know that September is but a suicide prevention month. We do not want people to commit suicide. As much as possible, we want to save life. We are not talking about of our own money. Money alone is not enough. Your economic status is not enough. We are talking of mental health. If this is money, this is mental health, susugurin niya yan, matatalo ang pera, kaya huwag masyadong mag-focus sa pera. Remember, one time, I will make a story, to make a story short, I met someone who is a corrupt person. He's always thinking of money, money, money. Dumating yung point, nagkaroon siya ng stress and now he's in the hospital suffering from stroke. It only means that if you will focus on good life and less corruption and avoid corruption, you can save your life. And most teenagers right now are suffering from too much anxiety and depression. So try to help them. Parents, if there are parents right now, always talk to your children. Please learn to listen. Stop screaming. Stop shouting. Instead, keep silent and learn to listen. You have only one day to live today. Make it the worst, make it the best one. Palagi natin iisipin, isa na lang araw natin para laging maayos ang relasyon natin sa ating pamilya. And when we talk of mental health, it can combat stigma. This is now the story. One policeman and one teacher in Laguna suffered from COVID-19. Their struggle ended for more than a month. It all started last August 14 and ended this September 20. And did you know that both of them survived the crisis? The man is a policeman in Laguna and he is a very workaholic person. Her wife is a teacher in one college in Laguna and the teacher is also a motivational speaker. Obviously, for more than 1 month, after they survive the crisis, one thing that they realize is life should go on despite of the fact that there is crisis. And I want you to meet that person, the teacher that I am talking about. And this is me. I suffered from COVID-19 for more than a month. I always cry. People told me, you are strong. I am strong, but I am afraid to be discriminated in my own community. Si Sir Gilbert, he doesn't know about it. Every time I conduct webinar in different schools and companies, I do not tell them that I am suffering from COVID-19. I always smile. And I realize that every time you smile, every time you pray, aside from the medicines, you can prolong your life. Now, the best reward that I can give to myself and the best reward that my husband received is this one. I will show this one. This is the reward for myself. This is not money. This is not an award. This is only a reward for myself. This is a medical certificate na nagsasabing, I am now negative from COVID-19. For those who are suffering from COVID-19, I always tell you, palagi ko sinasabi sa inyo, every day tumatawag kayo sa akin, hindi ako ang magduduksong ng buhay nyo. Kayo ang gagawa ng way para makasurvive sa inyong pinagdaraanan. So I hope that instead of stigma na iparamdam natin sa kanila, learn to respect people suffering from COVID-19. And for those who are afraid to be infected, you just pray, just focus on positivity. And it will help you a lot. So do not worry. Everything will be okay for as long as you're praying, for as long as you are giving good emotions every day, for as long as you're feeling okay. Wala hong tatalo sa atin, mas matibay tayo sa COVID-19. The next one, it can provide us early intervention po. Makita niyo weighing scale dyan. Makikita natin, habang pinapakita po, mas matimbang ang fears, ang worry, ang guilt natin, ang uncertainty natin, ang cabin fever, phobia, trauma, and SAD. Now, why is it that mas matimbang siya? Later on, you will rediscover something. We have a lot of fears, and these are all psychological tolls. We have this feeling of fear. Why? Because we are afraid to lose our life, our own life, the life of our loved ones. We worry a lot about our future, about our health. We have what we call the toxic guilt. Wala akong nagawa. Hindi totoo yun. Uncertainty. What if is always the start of your statement. What if tomorrow I can no longer see my loved ones? What if tomorrow, wala na akong makikitang tao? And what if tomorrow, infected na ako? Those are the uncertainties in life. And cabin fever is very common nowadays among teenagers. Did you know that a lot of teenagers might feel right now for 6 months, ini-stretch nila yung kanilang patience dealing with this new normal. They feel they are being confined for more than 6 months, cut off, chained, quarantined, trapped, isolated. So this is what we call cabin fever. Cabin fever is a distressing emotion. When you experience this one, parents, please observe your children. And for those who are listening right now, for those who are teenagers, college students, or high school students, these are some of the symptoms. If there is a decrease in your motivation, you always experience right now negative emotion. There is a feeling of boredom, irritability, impatience, lethargy, eating and sleep disorder, loneliness, engagement in some unhealthy activities. These are some of the effects of cabin fever. But again, I keep on telling you, young men and women, huwag kayong magpapadala sa cabin fever. Instead, connect with your family, discuss your problems with your family so that you will not think of anything that will harm your emotion and your own mental health. But aside from this one, most people now, or there are people suffering from phobia and traumatic experiences. Xenophobia is one of the phobia always experienced by young people, by adult people. Every time they go to the mall, what they think is that they can be infected, especially may katabi ka, umubo, feeling mo, meron ka ng COVID-19. So sometimes you feel that, oh my God, I am now suffering from COVID-19. That's not true. If you feel that it's not safe for you to go to the mall, later na lang siguro so that you will not experience any phobic reaction. For those who are suffering from post-traumatic stress disorder, consult someone whom you think can help you so that you will now go back to the normal self and normal life that you would like to have. Because it a lot of stress, as you can see there, it can harm us physically. Tingnan niyo mabuti ngayon, sobra-sobra na yung kamay na gumagala sa kanya because these are the red flag signals of stress. The stress can come from your own home. If the parents and the family members do not have good relationship with you, sometimes you experience stress. So I am hoping that you have good family members. If you experience frequent tiredness, frequent worrying, frequent crying without any reason at all, your pain at the back, stomach ache, back ache, head ache, all types of ache, and then sometimes you do not want to sleep, and there are people who always sleep, they do not want to get out of their own bedroom, skin problems, they have rashes, and then sometimes they want to avoid talking with people, they experience irritability, loss of desire to perform a task, and sometimes nightmare. All these could be the possible red flag signals of stress. The stressors could be internal or external. When we say external, it can be experienced by person, and those external stressors, nandiyan lang sa paligid nyo. So, yung traffic, paano makakarating sa work, anything that you can feel outside your own home, that you can see outside your own home, they can give you stress. But when we talk of internal stress, one example, ito yung trap sa utak natin, yung negative self-talk. If I were you, starting focusing on good things rather than negative things so that you can avoid. Although stress is part of life, the most important thing is that we can manage well our own stress and lessen those stress or causes of stress. Because aside from stress, because stress is what our response to our own demand and threat in all our activities. It could lead into anxiety. And anxiety is but a response to our own stress. If you are feeling not good today and you have all these feelings, a lot of time, again, you try to reflect and tell these things to your parents, to the caregivers in your family, whoever is that person who can understand you. You consider that there are stress and there are people suffering from anxiety because stress can cause anxiety at the same time. Irritability, panic attack. I have now a client suffering from anxiety. He was diagnosed by a psychiatrist, and right now he always experience panic attack, scary feeling, tapos na po, napagdaanan na, takot pa rin siya, he worry a lot, fear, phobia, tension, muscle tension, dito po laging masakit, wala naman siyang sakit talaga, faster heartbeat, palpitation, dry mouth, even LBM, chest pain. He went to 3 doctors. There's no such thing as diagnosis of heart problem. Talagang anxiety po and poor concentration. Girls and boys, mom and sir, sana mabawasan, sana hindi ma-experience at kung meron man, malabanan, ma-handle para po tayo mabuhay na maayos ngayon. Because too much stress and anxiety can result into depression. Do not diagnose yourself as a depressed person. Do not use depression as an adjective. If you are teaching English subject, depression isn't an adjective that will describe a person. It is but a condition that can only be diagnosed by a psychiatrist or by a psychiatrist. If you're suffering from depression, hindi sila OA. Sometimes they don't even know why they experience extreme sadness, feeling of worthlessness, feeling of hopelessness, and they also experience unreasonable guilt, sleep problem, aches, tantrums, isolation, withdrawal, and the worst is suicidal ideation and attempt. There are people who just think of suicide, but they do not actually commit suicide. But if you notice that one of the family members has a cutting behavior, hiwa, 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 talk to the person as much as possible. The inner wound of that person can be healed if there is a good support system that will come from the family and ask professional help to totally help your children. Remember, if you are now suffering from depression, anxiety, and experiencing a lot of stress, on the next slide, ito po yung gawin natin. SSS, kapit lang at muling bumangon. What do I mean by this one? Your social support system can help you to experience good life. If you have now a support system that will guide you and guard your emotions, you will always think of having a long life to live. Always tell yourself, to the help of the SSS, kailangang kumapit at muling bumangon. Tumayo ka ngayon, lumaban ka, at sabihin mo, kaya mo ito. We are rational beings. We can beat pandemic crisis for as long as we are having strong mind and strong physical self. Remember, we all need help, and you can also provide help to other people. Help is important, and help has a meaning. If you would like to give help to other people, please tell them the help that you're going to give is not reciprocal. You're not going to expect anything in return. You are going to help because that is your mission in life, to help those people. But before you can help other people, help yourself first. I hope that you have a good mental health so that you can easily help other people. And this is the help that I am telling you on the next slide. We can help. All of us, we have the capacity to help other people. First, if you have compassion, you can help people suffering from emotional problem, being exhausted or whatsoever. And if you are committed to your work, to your mission, you can implement things that can help them to become good people. There are three things that you can give. First, give them care, give them love, and give them hope. And when we say hope, that is the only thing that you can give that cannot be bought by money. And even care, hindi yan mabibili ng pera. So the care, love, and hope are important things that you can give to other people. And the positive attitude that we have to possess is our own humble self. Humility is the best thing that you can have in yourself. Because if you have humility, you will understand that you have three important parts of the body that you can use as your listening skill. Remember, there are two external parts of the body that you can use to help people. There is one internal organ that you can use to help people who are suffering from maybe some problems in life because of pandemic crisis. Number one, you have two eyes right now. These two eyes can be used to have undivided attention. You have the focus now because of your two eyes. You have these two ears because your ears will help you to listen to the grievances, to the pains and ways of other people. Always tell them after using your heart, and that is your internal organ, that you care for them, you love them, and you are giving them hope. And after giving this, after listening, after making use of these three skills, these three organs of your body, what will be the end result? You are now giving a life to other people because you serve as a blessing for them. So please say yes if people are asking help from you. Please, I am now begging all of you to help other people so that our society will become a peaceful one. Remember, in helping people, what we need is one characteristic, one trait that we have to possess. And on the next slide, there's only one thing that we have to bear in mind, and that is your resilient behavior. Your resilient behavior, your psychological resilience, that is your own strength. your inner strength. And that psychological strength will deal with stress, setbacks, crises, hardships that affect our life. This is but a built-in strength. This is one way of bouncing back to reality. Laglag, tatayo, kakayanin. Remember, I suffer from COVID-19. Alam niyo bang naisip ko, I do not want to die. I want to see my family. I want to be with my family. And I want to be with my students. I am now teaching at CGC Cabuyao and Binyang. And they're one of the reasons why I continue living. So always think of those people that can inspire you to prolong your life. If you have psychological resilience, kahit dapang-dapa ka na, you can still tell to yourself, babangon ako, kakayanin ko ito. On the next slide, resilience has categories, pillars, and characteristics. Did you know that we have what we call the physical resilience? When we say physical resilience, that is our own stamina and strength. That's why we can move the parts of our body. We can go to the mall, we can go to the park, we can walk, we can jump, we can scroll. Okay. Community. Observe your community for 6 months. If you are living, for example, in a community wherein people are suffering too much problems, they are now having no job at all, they do not have foods to eat, always use of this one, community resilience. Help them to adapt to the disaster that they're suffering right now. If you have emotional resilience, you can easily adapt to any situation which is stressful. You can cry, you can shout just to release your emotion, but go back to reality that you have to adapt yourself to this stressful new normal. And the most important thing is your psychological resilience. Mentally, physically, psychologically, in all aspects of life, apektado po nito. That's why when we say psychological resilience, this is but one way of coping with crisis by using your head, using your brain, using your heart, using your body, everything about you. All these things can help you. Maniwala po kayo, if you have a resilient behavior, you will experience the pillars. And these pillars are self-awareness, mindfulness, self-care, positive relationship, meaningful relationship, positive emotion, positive engagement, and positive purpose in life. If you have all this positivity, the pillars of resilience, nasa iyo yan ngayon. And remember that if you are a resilient person, you have your own characteristics. Number one, if you have the ability to detect the cause of your own problem, you are now considered as a resilient person. Why am I not happy today? Bakit ako malungkot? So dig deeper to the reason. What causes you to become lonely today? Number two, know to handle your emotion. If you're not happy today, if you don't have any experience of pleasant emotion, learn to handle well. If you are dealing right now with other people, huwag mo silang idamay sa lungkot mo. Instead, assess yourself because as I told you, you have to know the reason of your own emotion, of your own feelings, of your own situation. That's why learn to handle well because you have to keep calm all the time. Calmness, coolness can help you to maintain mentally healthy. Even though you are facing stressful situation, you are now feeling so good about yourself because you are always calm. You do not shout at all. You always tell yourself, I have to be good. But if you want to be good, you have to do something to make yourself good. Realistic. So you have to be realistic also. Always tell yourself, you have your own expectation, but you have to be real to yourself and realistic that this is what is happening right now. I have to face this one, but I have to do something to make myself better. And always trust other people. If you trust other people, simply because you trust yourself. So trusting yourself is another characteristic of a resilient person. And if you know how to empathize with people, if you're full of empathy, you always put yourself in their position, you will experience something, and that is understanding how they feel. When you understand them, simply because You put yourself for the meantime in their position. Now, all these characteristics of resilient people can help all of us now to deal with the pandemic crisis. I want all of you to remain okay, to remain mentally healthy, because my mission in life is to help people, to make people believe, and to make their life okay all the time as much as possible. So this is what we call resilience. Now, after this, we have what we call the scale of resilient behavior. Alam niyo ba, if you're going to focus on the sources of stress, why not make it, for example, shorter? Reduce the sources of your own stress. If you feel that one of the family members, for example, lost his own job, nawala ang kasama sa buhay because of COVID-19, a lot of schools now were closed, and you have your negative thoughts, reduce the sources. What must be done? Load the positive side. And this is whether you are now having problems with your health, physical health, whether you don't have a job at all, if you have a responsive relationship with your family members, and you have more connection with people, and you're giving more hope to yourself, you can be a better one. Remember, hope has three meanings, and hope has three colors. Think of three colors now. Anything that you can think will reflect your own personality. Number one color. The first color of hope is we have to remember good things about life. So remembering pleasant and unpleasant experiences for as long as they give lesson to us, that is the first color of hope. The second color of hope, think of another color. And the second color will give you and will tell you, fight back. When you say fight back, hindi ka uurong, alamin mo ang problema, at gagawa ng paraan para sa iyo mabigyan ng solusyon. The third color of hope, another one. Think of another color, and that last color will tell you, celebrate life. Life is given to us once. But do not tell yourself that life is short. I always see the Facebook nakalagay sa kanila, life is short. Again, life can be long. You can prolong life if you have a positive mind. That's why always remember that when you deal with celebrating your own life, enjoy your life, for as long as you're not harming other people, you're giving more hope to yourself that you can survive and you can beat COVID-19. But sometimes you can move the fulcrum and strengthen your life skills, add more positive people to your life, add more good experiences, delete negative thoughts, continue living in the new normal, and start a new journey in life. Discover your skill, discover your new journey, and remember one thing, delete things which are not important for you so that you can move the fulcrum positively. Move natin yan ngayon. Okay? Next po, I will give you now, so you can see there na nag-move siya because this is now the end result. If you have experiencing right now, if you experience a lot of changes, a lot of challenges in communicating with people, in the educational system, in your own mental health, but if you have resilient behavior, if you're going to add them, you can still have a sound mind. Whatever challenges come to your way, always think of one thing. I am a worthwhile person. And that should be your mantra. It will help you a lot. And how you're going to build and strengthen your resilient behavior during the COVID-19 outbreak. The next slide will tell you now. One, unload negativities. Please put in your mind the let go principle. When we say let go of your fear, let go of your worry, let go of your guilt feelings, and reframe yourself so that you can unload negativities. The second one is face your stressors. If you feel that your family member is one of the stressors, the best is to talk, communicate to settle the conflict. If you feel that one of the stressors is your coworkers, for the meantime, you just keep quiet. Now, if you feel that you are calm, then talk to that person. Always think of the best way to face the stressors in life. And you have to practice positive attitude. Love, humility, and hope. These three can help you now to develop a good self and to fight back all the negative things in life. The next one is practice your faith. Sometimes there are people who just pray because they are suffering from too much emotional problems, too much difficulties in life, or adversities in life. But this time, you have to practice your faith. Masaya man or malungkot, kailangan lagi po tayong meron ito. It will help us a lot. Remember, for more than a month, ako po ay may COVID because of this faith, regardless of religion, I am now clinically cured according to the doctor. Discover your new journey and strength. Learn to engage into physical activities. Learn to engage in some of your skills that you are not performing before. One example is you can dance, you can sing, you can engage into Zumba. Whatever things will give you inspiration, will give you pleasant emotion, do it. Wala pong pwedeng mag-judge sa inyo. And what I did during the time that I suffering from COVID is I meditate a lot. Now, I will mention three names. Mitch, you're a single mom and you are now suffering from COVID. Manong Police, you are just a 20-year-old man suffering from COVID. Pray a lot. And Celia, you are a single mom of 3 children. Please, after the webinar, tell yourself, I need to have a good life to live. I need to overcome this problem because I have 3 children. I asked permission from these three people to mention their names because I want all of you to get inspired and for them to be inspired that whether they have crisis, whether they have good life to live, the most important thing is that laging iisipin, mabubuhay kapag tayo nagpo-focus sa magandang bahagi ng ating pagkatao. I always engage into meditation in order for me to have a strong life to live. And the best is ask help. Please, you have your guidance counselor in your school. The guidance counselor can help you a lot. The guidance counselor understands problems that you're experiencing right now. Please tell your guidance counselor, Mom, I am now suffering from this problem. In your own organization or company, in your own hospital, you have your psychologist. You can ask help from them, from your psychiatrist. The psychiatrist can make some sort of diagnosis and treatment about your mental health condition. The psychologist can help you because they can give you again a psychotherapy that can help you to go back to your normal life, and the guidance counselor, because I am a former counselor, I always tell students, do something good to yourself for you to overcome your problem. Please do not hesitate to ask help from other people. I have my helpline. You can contact me after this one. And I also have one YouTube. Hindi ko po sila ma-manage. You can click one-on-one with Noralle Collado and you can see their depression. That is but a 45-minute interview by Laguna Channel, Chris Sanji. And this depression, I think, is more applicable for college students because the topic has something to do on how students cope with depression, how students handle depression. And at the same time, since I used to be a resident psychologist of J101.5, I discuss things about depression, teenage pregnancy, and the rest. So I can share these things to all of you because I really want to help a lot of people nowadays. But this time, I have now a new friend, although kasama ko siya before. So I am inviting all of you after the webinar by next week. So you can see me at DZRJ Mega Manila. I will discuss again tamang gabay sa kaisipan sa bagong panahon. Again, it has something to do with mental health. Before I end, ito po yung pababasa ko sa inyo. The next slide will tell us now. Resilience is knowing that you are the only one that has the power, responsibility to pick up yourself. What do I mean by this one? No one can tell you to become resilient but yourself. Tell yourself now, I can be a resilient person. I can put these fragmented pieces to make it again a real one. And I can help myself. I should help myself so that later I can also share love and help to other people. Make use of these two things. Let it go attitude, and the other one, make a short note to yourself. You can do it now. I am okay. You can see on the slide, I just put there, I am okay. Okay? So after this, it doesn't mean that all of you are okay. But after this, you can send messages, you can ask questions. After this, you can tell yourself, Mom, sir, I am okay. I need to be okay because I want a long life to live in a good mental health. Sir, mom, teachers, and all professionals and students right now who are participating in this webinar, thank you, and I hope that you learned something today and have a nice morning. And do not forget, you have to smile, and that is one way of investing a good life to live. 10 seconds of your life can help you to become a good person and to prolong your life and to have a good mental health. Salamat po.
Oh boy, that was really awesome, ma'am. And
Thank you.
please take a look. I am smiling now. Anyway, thank you very much for that highly informative and most exciting talk, I should say. I am sure that our participants, and in fact, some of them commented on the comment box on at FB Live. I am sure that they have gained numerous new insights which they can apply in their work, in their studies, and in their day-to-day life. Ma'am and everybody, let us open this part of activity to the public, to you, our dear participants, especially to those who have questions. You may write them, please, on the comment below. I will read. And some of you have actually submitted your questions during the registration, so I have a copy of them. I summarized some, and I will read them now. Yes, ma'am, are we ready for the question and answer, please?
Yes, ma'am.
All right, the first question. This is all about stigma. These two questions I think are so much related. What are some simple ways or solutions to address stigma that leads to discrimination among mentally ill clients, especially in the family and community? And another question, what is your perception on the arguments between families, having family members suffering from mental problems who don't want to consult psychiatrists due to shame and stigma? Ma'am?
Okay. There should be an open communication because one example is in one community, there should be an open communication among the members, among the residents, so that stigma will be avoided. Because it could affect the mental health of an individual. So open communication is important among the residents in one community and also in your own family. Now, if the parents, or for example, one of the members of the family or the person is suffering from mental health, do not want to consult a psychiatrist because he or she is afraid of stigma, please, one of the members, please tell your child or the family member that consulting a psychiatrist or professional person will help them to process more themselves so that they can live a better life to live. Do not be afraid of stigma. I also experienced that one. I am afraid to be discriminated. But what I think is that if I will just tell myself I do not want people to know this one, what will happen to my life? That's why I am now a living example. Instead of telling those people suffering from this problem, wala kang kwenta, wala kang kinabukasan, respect them. What they need is only respect and love. Those are the only things that are needed by people suffering from mental health problem and COVID-19 crisis. Respect is a key word and the only answer for that.
Doc
Ma'am, I
Doc,
cannot hear.
your mic, please.
Yes, thank you very much. Sorry about that. And sorry about the dogs in my background. They're not ours, they're our neighbors. I guess the dogs barking in the background is part of the new normal. So, anyway, to continue, as I was saying, there are three exciting questions here, ma'am. I believe they are related to each other, so I combined them. What makes this more exciting is that one question comes from a student, the other, I believe, comes from a teacher, and the third comes from an administrator. So let me read the first Question from the student. As a student, I am now facing a new type of learning, which is the online classes. What advice can you give me to cope with stress, anxiety, and burnout feeling that the students are currently experiencing during these online classes? And from the teacher, what school policies can we have to address the problems of mental health among our students? And from the administrator, what are the effective strategies in order to strike the balance between mental health care and still delivering competitive curriculum? Ma'am?
For the student, whoever you are, I'm also teaching online class. So I also experience stress. After teaching and after my student, for example, finish their online class, I always tell them to make use of this exercise. Inhale, exhale, and at the same time, you can journal your experiences every day so that you can release your pent-up emotions. One example, I feel so stressed today. Just jot it down in a piece of paper because every time you release your emotion, it is gradually helping you to become okay for that day. Again, this is but an experimental period. A lot of people suffering from stress, teachers, students, and all workers because of the online way of delivering services to people. No? So, student, I understand you. So the best that you can do is journal your experiences, release it gradually, talk to those people whom you think can understand you so that you can release all the pent up emotion or inner conflicts that you're experiencing right now. For the school, I hope the school has a good program because nowadays, even though they are not having face-to-face relationship with students, with the clients, so this is but a challenge for the guidance counselor to think of a program on how they can identify the problems of students, on how they can help students nowadays to manage their own mental health. Guidance counselors, advisors, and administrators of different schools, the best thing that I can do, the best thing that you can do for the school is provide a program for the students in a virtual manner that can help them to assess their own feelings and what necessary tool or psychological tool or help can be given so that for the rest of the semester school year they will be the same student with a good heart, good mind, and better self.
Thank you so much, ma'am. I'm sure you're getting a lot of insights from those answers. Now, here's, I think, is from a researcher, how to select the scale to investigate the student's psychological state.
Ma'am, yung tawag po na asa, pakiulat po, ma'am.
Forgive me for that, ma'am. Forgive me. How to select the scale to investigate the student's psychological state.
Okay, ma'am. Actually, there are several ways, scientific ways of knowing and assessing, for example, the mental health of students. One, you can conduct an interview, assessment of behavior or mental health by giving psychological tests, and sometimes by giving counseling depending upon to the needs of the students. But again, the most important thing is you have to assess it by means of the best is by means of talking to the students so that you'll be able to know what are the emotions that he is feeling right now. So several tools can be used, guidance tools, psychological tools. So we are using, for example, psychological tests for us to know for example, the personality of a person, the traits, and even the emotions that they're having right now, and counseling.
Thank you so much. Yeah, I cannot see the other questions from my end. Do you have questions there, Sir Gilbert?
Hi po, Doc Bambi. So as I was watching the live from our official Philippine Women's University Facebook page, I think there's no question since most of the participants give thanks to the speaker and to the conduct of this webinar session. So I think, ma'am, there is no question. But if there are questions, please post it now so that our webinar facilitator and the speaker, while they are here, can answer your questions po.
Okay, thank you. There's one here. Uh, I think this is also exciting. I'm not sure. In breaking the negative aspects during the crisis, how do we avoid toxic positivity?
Okay.
That's quite
Okay, do not tell yourself that you are okay if you feel that you are not okay. Always tell yourself that I have to admit, I have to allow these emotions, negative emotions, and later make some sort of investigation where these emotions, for example, came from. Allow your emotion to flow will help you now to avoid toxic positivism. If you want to become positive in life, the best thing that you can do is to accept that you are not good today. So that later on, you will realize that you need to be okay by allowing those negative emotions to flow. And at the same time, you have all the chance to think of good emotions that can help you to become more positive. Sometimes, positivism or being positive can be felt when we experience, for example, crisis in life. Now, toxic positivism is always experienced by those people just telling themselves, I am okay, but not doing something to themselves. So that is toxic positivism. So you have to do something in order to become a real positive person.
okay, ma'am. Thank you. Now, I got another one. I'm not sure about this, but let me read it. What is the incidence rate of suicide or depression now in relation to COVID as compared to before the period of pandemic?
Ma'am, I have to be honest. I don't have any data for that one. But again,
Okay.
sa WHO po lumalabas na the age of 15 to 24 to 29, sila yung mas prone to experience or to engage into suicide because of
Mm-hmm.
the pandemic. But I cannot give you now the number.
Oh, okay, okay. Maybe they can check the WHO page. Ma'am, here's another one. Are we still open for questions, ma'am?
Okay po.
Yeah, after the pandemic, how to build up the minds of medical workers? I mean, maybe you know what he means by this po.
How to do the finding. Ma'am, even though there is pandemic or without pandemic, medical workers, frontliners, remember one thing. You need to pray, you need to strengthen your skills, you have to make use of your inner strength, and that is your bravery. Always face the reality, right? Always tell yourself, I'll give you one mantra. Whatever happened to my life, whatever life will be, for example, will happen in the near future, always tell yourself, I am a worthwhile person. So just give one mantra so that you will be able to have, for example, a good life. After the pandemic, say thank you because tapos na po ang outbreak sa buhay natin. Always use gratitude because gratitude can help us to become strong people. You are all warriors. I really admire medical people, medical frontliners, because without you, what will happen to our society? That's why I give respect to the frontliners, especially the policemen and the medical workers. So I adore all of you, ma'am. I really admire all of you.
Thank you so much, ma'am. That is really heartwarming.
Ma'am
Now, there
Bambi,
are, yes, Sir Gilbert, go ahead, please.
I think there is a question from the online chat here. Can I mention, ma'am?
Go ahead, please.
Okay, there is a question from Giselle Damaso. The question, Ma'am Collado, is how can we determine if someone is a high-functioning depressed person and how can help them?
Sir, we are not allowed to make any diagnosis, but if the person can see a lot of symptoms about, for example, an individual suffering from such thing, the person is always experiencing extreme hopelessness, extreme worthlessness. The person keeps on telling, I want to die, I want to end my life. The person can no longer deal with reality. The person is telling other people, I can no longer deal with this life. I want to end my sufferings. So, the best is do not make any diagnosis. Instead, refer the person to the proper authority so that person, authority can help that particular person. Again, for those students who are making self-diagnosis, when you click the internet and you're going to look at the symptoms, you may say to yourself, lahat ito akin. Instead of doing it, consult someone, a professional person who can explain to you what is your mental health condition. That's why there are people who feel so lonely, who feel so depressed, because they make use of self-diagnosis. Avoid doing it. We are not all psychiatrists, so let the psychiatrist make the diagnosis and not yourself. So you can only help that person by referring to the proper authority.
Okay, thank you po, Doc Collado. Ma'am Bambi, there is one more question. I think
Go
this can
ahead,
be the last
please.
one from the live chat. This is from Sir Bob, Tom. So the question is, I visited Australia last year in November. Nurses said that suicide increases as the Burr months come. So is there any explanation or relation with this?
Okay, because when Burr months comes, we experience a lot of stress in life. First, when it comes to financial aspect, we have to, for example, we have to prepare for this coming Christmas, because we all know that people are very excited when they hear the word Christmas and New Year. So bare months can add stress to life. Plus this triggering situation, pandemic crisis. These two, when being combined, can cause a lot of negative things, a lot of negative emotions that can result sometimes into thinking of suicide if they can no longer deal with their own stresses in life.
Thank you, ma'am. Now, here are two questions that I find exciting again. One is, how would a person know if he or she is not mentally healthy? And related to this, another asked, how can you say that you're still mentally stable if a lot of things are bothering you? Does thinking too much at night, does thinking too much at night to the point that you can't even breathe is stable? Is this still healthy, ma'am?
Okay. If you always feel overwhelmed, uninterested, and your emotion is becoming uncontrollable, you always think when it comes to 2 a.m., p.m., you do not want to sleep anymore, you cannot sleep anymore, you always make, for example, difficult decisions in life, you have crying spells without knowing your reason at all, maybe the best is seek help from a professional, because he's the person who can tell you what is happening to yourself. So do not be afraid of consulting a psychiatrist or psychologist. Bear in mind, they can help you. They are the proper authorities who can help you to understand your emotion. Huwag po tayong matakot na sabihang may toyo ka. You are going to a psychiatrist or psychologist because you do not want to have a mental health problem. If you have symptoms, everything can be treated by means of asking help or professional help. So do not be afraid. So always check your emotion.
Okay, emotions check. Thank you so much, ma'am. I believe the other questions have been answered during the talk. There are quite a lot of them which have been answered during your entire talk, ma'am. So I think that wraps it up. Yes, Gilbert, do I hear you say yes? We stop with the question and answer now and
Yes, ma'am.
proceed.
Yes, ma'am. I think it's 11:43 already. I think we can
Yeah,
proceed with the awarding for our
yes.
speaker.
Thank you so much. Okay, ladies and gentlemen, the question and answer portion was, what do I say, was surprisingly notable, and we are beside ourselves with so much gratitude to our dear resource speaker for, of course, her time and her exceptional ability as a registered psychologist. So, as a token of gratitude, we present to her the certificate of appreciation, wherein the citation shall be read by our loved Dean, Dr. Minerva de Ala. Ma'am?
Thank you, Doctor. Okay, this certificate of appreciation is given to Ms. Noralle Collado for her selfless and commendable service rendered as our resource speaker during the conduct of webinar entitled Mental Health Resilience Amidst the COVID-19 Pandemic, given this 26th day of September 2020 at the Philippine Women's University. Signed, Mr. Christopher Nemes, the chairperson, and yours truly, Dr. Minerva de Ala. Ma'am Noralle,
Thank you po.
Okay, thank you so much, ma'am. Thank you, Ma'am Deala and Ma'am Noralle. Yes, this certificate is our symbol of our deepest gratitude for your time and as I said earlier, exceptional abilities, and for all those exciting answers to our exciting questions. Okay, ladies and gentlemen, thank you so much for your participation, for attending our webinar. It has been a day of fun and new learnings. Now, please stay put because my classmate here will explain to us how to answer the evaluation and how you will get your e-certificate. So may I call back Mr. Gilbert Bagsik.
Yes po, thank you very much po, Doc Bambi, and also to our very brilliant resource speaker, Ma'am Noralle Collado. Thank you po, ma'am. Thank you po, ma'am. So as we near the closing of this webinar, it is also important for us to know the different aspects on how we will still improve the quality of different webinar sessions. So with that, we are asking all of the viewers and the participants of this webinar to please evaluate us using this link. So it is being flashed on your screen right now. So it's https://tinyurl.com/PhD mental eval. Okay, again, it's https://tinyurl.com/PhD mental eval. So on the other hand, if you have your smartphone and if it has a QR code scanner, so you may also scan the QR code that is being flashed. So it is important for you to evaluate since this will serve as the basis for your webinar e-certificate. So again, thank you for your cooperation and for participating on this webinar session. So keep safe everyone and good day.
Miss Bambi.
Oh, yeah, sorry. Thank you very much. So, your evaluation is so important. So, please help us. Click that link and answer. Okay, ladies and gentlemen, to give us the closing remarks for this webinar, may we call on our professor for the course Practicum in Nursing. And of course, she is the Dean of the School of Nursing of Philippine Women's University, Dr. Minerva De Ala. Ma'am.
Thank you. Mr. Marco Benitez, the University President, Dr. Filina Siyang, our Chancellor, Ms. Noralle Collado, our resource speaker, faculty members, colleagues, students, friends, guests, good morning. The emergence of coronavirus disease caused a tremendous impact to public health, economy, education sector, and other businesses that resulted to socio-economic crisis and profound psychological distress. Several psychological problems that involve mental health that encompasses stress, anxiety, depression, frustration, boredom, fear, and uncertainty that was mentioned by our research speaker. Likewise, the psychological impact of community quarantine implemented to halt transmission of this infection added more effects to the mental health of the people. This webinar is very helpful for each and every one of us. Thanks to our dear speaker, Ms. Noralle Collado, for your insightful words of positivity. Hearing the importance of psychological resilience will enable us to help ourselves to retrieve or restore our psychological well-being in this stressful condition. Today, we learned the other meaning of COVID, which are the fighting arms or the words of a person to outlive the negative effects of this disease, which include C for courage, O for optimism, V for victory, I, inspiration, and D for designing our lives. Allow me also to add the words of Amit Ray that in every crisis that we have, doubt or confusion, we have to take the higher path, the path of compassion, courage, understanding, and love to overcome crisis. We know pretty much that each and every one of us here is hoping and praying that soon we can have our normal way of life again prior to the pandemic crisis. Also, before I will end this talk, I would like to commend the effort of the organizers of this webinar, headed by the chairperson, Mr. Christopher Nemis, and Mr. Gilbert Bagsik as the co-chair, and the working committee, of course, the support of the ICT staff and the multimedia. Thank you for your assistance. Good afternoon. Should I say good afternoon? It's almost 12. Thank you and good afternoon.
Thank you so much, Mom. Thank you really for your support. And of course, this webinar would not have been possible without the help of these great people. Our University President, Marco Alfredo Benitez, our Dean, Dr. Minerva de Ala, our Program Chair in the Information Technology, Dr. Menchita Dumlao, the Information Communication Technologies Department Head, Mr. Michael Ventanilla, our AV Specialist, Sir Robert Thomas, our ICT department, from the ICT department, Lourdes Cabatuando, the administrative assistant, Jennifer D. Girella, our administrative assistant also in the School of Nursing, Celia Francisco, admissions and marketing manager, Nelson Guillen, our multimedia and broadcasting department, Emmanuel Giban, administrative officer in the Office of the President, Marivic Piterona, and of course, the people from the PhD in Nursing curriculum and our classmates in the PhD in Nursing course. Of course, for the webinar committee, overall chair, Christopher Demis, a round of applause. Our co-chairperson and committee for program and evaluation, Mr. Gilbert Bagsik, thank you. Secretariat, Ms. Esperanza Banabata, and for documentation, me, Dr. Maria Dalia Rañez. We also say good luck to Group 1 for next week. So thank you very much, everyone, for your attendance and participation. And to conclude this activity, friends, let us all sing the Philippine Women's University hymn.
Wherever we may roam, God is
much. Thank you, ICT Department. Thank you, everyone. God bless everyone. Yes!
Hi. Hi, thank you everyone. Thank you. Hi, salamat.
Thank you po. Thank you.
Yes.
Thank you for the support.
Nakakakabang, pero thank you po, Sir Bob and the team. Thank you so
Sa lahat
much.
po ng technical team po, maraming
Thank
salamat
you.
po.